Good afternoon, I'm Roniel Florendo. I'm a graduate of the University of the Philippines, Manila, class of 2013. I'm currently a physical therapy staff here at UP Sports Physical Therapy Clinic and as a physical therapist as well at St. Clair's Medical Center. So I've been practicing PT for about 2 years now. In my practice, I have handled several different cases who require therapeutic ultrasound as part of their PT management. Among these cases are acute to chronic orthopedic conditions, which are not limited to strains and sprains. I've also encountered patients who require application of therapeutic ultrasound, particularly those patients with adhesive capsulitis and those with muscle contusions. I've also used ultrasound for patients with hand problems, particularly those problems such as Decker veins, stenosing tenovaginitis, particularly those who require healing of the tendons around the region of the wrist. And then I've also handled patients with neurologic conditions who require application of therapeutic ultrasound, particularly patients with stroke. I've applied therapeutic ultrasound as part of my management for improving flexibility and to decrease pain around joints of patients with stroke, also with CRPD or CRPS. The disadvantages I've encountered or I know about using therapeutic ultrasound for prolonged period of time would be occurrence of fracture or brittle bone if you use ultrasound for 14 consecutive days. In my practice, I actually follow this protocol that you have to provide rest or you have to stop application of therapeutic ultrasound after 14 continuous days because it will actually potentially lead to occurrence of fracture. Also, ultrasound is actually just a placebo according to some studies. Some patients actually rely on therapeutic ultrasound hoping that they will improve and hoping that their condition will be resolved. About the contraindications of ultrasound, among the many patients I've handled, I've encountered patients with cardiac conditions, particularly those with demand pacemaker. It's a general contraindication. Patients with demand pacemaker is a general contraindication for ultrasound because this pacemaker actually sends out signals to the heart. If you apply therapeutic ultrasound, the US waves sent by this machine could actually disrupt the stimulus and could actually lead to irregular heartbeats, which could be fatal for these patients. Also, another contraindication would be for patients with decreased sensation of the skin because they won't be able to detect if there's a burning sensation already. So we don't actually want to cause internal burning or even external burning for these patients, particularly the geriatric population or the elderly people. Another contraindication I've encountered would be for the children because this children actually has the epiphyseal plate, if you're aware of that. This is the region of the bone which is could actually lead to general growth of the children. If you apply the therapeutic ultrasound over this epiphyseal plate, you could actually disrupt the growth of these children, could lead to further complications such as leg length discrepancy in the future. Other than that, yeah, that's it. I think.